Well, good morning, everyone, and welcome to the second in our community conversations series. As you just saw, this is being recorded, and we will plan to record all of our community conversations. Shortly, I will be putting in the chat box the link to our first community conversation if you missed it. It was an absolutely wonderful opportunity to hear from Doctors Todd Lucas and Beverly Walker Graffia. And we focused on breaking down health disparities. So you don't want to miss it if you did already. We are very excited for those who are able to join us live this morning and looking forward to sharing this with any who were not able to be on with us today. I am Jeff Larson, and I am your community development local liaison here in Flint. Joining me today, as always, is our American Cancer Society team of Mindy Odom and Jenny Beamer. Jenny will mostly be behind the scenes. She is running our slideshow today, but Mindy gets to pretty much be our host today. So hello, Mindy, and take it away.
Thank you, Jeff. It's an exciting role to play today. Okay, so in 2019, the American Cancer Society applied for and won a special grant awarded by the Robert Wood Johnson Foundation. Now, this grant was aimed at addressing financial toxicity as it relates to cancer care in Flint. An example of that might be, are there patients in our community that are not getting their full cancer care because of an unexpected bill, a job loss? Were there resources available for them, but they didn't know about them? Is there a gap between a need and a resource? And so we wanted to look at this, but first we had to gather a group of task force members, starting with a co-lead. Which brings me to our special guest speaker today, Yvonne Lewis. Yvonne is the founder CEO of the National Center for African American Health Consciousness, as well as the outreach director for the Genesee Health Plan. Now, Yvonne is connected, she is driven, she's passionate, she's dedicated, she's all of the things that we needed for a co-chair. Most importantly, she said yes to us, and she helped us build a wonderful group of individuals. It was on the previous slide, but we have people from MTA, HAP, our local treatment centers. Thank you, Jenny. We really have a diverse group of smart, driven individuals that helped us create a realistic and sustainable resource for patients so that we can help connect people to the resources they need when they need them. And Yvonne is going to be sharing how we did that, what it was, and everything in between. Yvonne, it is such a great pleasure to hear from you today. Thank you for taking the time.
Thank you, Mindy. It is my pleasure to be a part of this group, but also to have the opportunity to share with you today. For those of you that are listening, I just want to say, none of this work can be done in a silo. We needed to figure out how to work together. That leads me to suggest, to say that sometimes when we think about, many people think about Flint, they think about, first of all, the Flint water crisis, and sometimes the challenging and unfortunate stories. But one of the things that we've learned through that is the real need and power of relationships, partnerships, where there is a commitment to establishing processes and systems that lead to sustainable program change and services that will be ongoing for our community. And so that's how we organize this group. We built on the relationships that we had learned about and nurtured during the water crisis, and I say continued water crisis, but all the other things in between. So that list of partners where we weren't new to each other. So it was easy for us when we learned about this opportunity at a meeting where partners were all joined together. One of the representatives from the Cancer Society came to a meeting where we were developing plans for another project called the Flint Center for Health Equity Solutions, and talked to us about this opportunity that Robert Wood Johnson Foundation was offering, and Flint, Genesee County could be a part of that. And so in listening to that, was very intrigued because we already had work going on in our community around cancer. And so looking at what was necessary from previous work, it was easy for us to start to have a conversation about who should be at the table and what could they bring. So when you look at it, mass transportation, because one of the things that we know is health is more than the absence of disease. We talk about social determinants, those other factors that in fact affect our health that we need to consider. So having the transportation authority at the table, having a health plan, having our Healthy Flint Research Coordinating Center, the Genesee Health Plan, and the list goes on. And of course, we can't forget representatives from Hurley Hospital and the cancer centers. These were all vitally important to us addressing the issue of cancer. One of the things we learned when we took our first trip to one of the sessions that Robert Wood Johnson organized to help us learn about their program, we looked at the opportunities that were made available. They said, oh, you can address housing, you can address food insecurities, and you can address financial toxicity. Now, I must say, the term financial toxicity at that point was new to many of us. But as a result of our history of working in Flint through the water crisis, we already had a lot of work being done in Flint around food insecurities, as you could well imagine. And we also had work being done around housing. But what we didn't have was a real coordinating plan to look at the financial burden that cancer would have on our community. And one thing we do know in that case, cancer is really an equalizer. It doesn't matter how much money you have. It doesn't care about the education status that you have. When you are faced with cancer, and I'm sure you're going to hear some of this in the future, it is very expensive. The other thing we knew is that people were not aware of programs and services that were available. So we selected financial toxicity. And as it turned out, we're the only community in the cohort that's working on this right now that is addressing this issue. So hopefully the lessons that we are learning and what we will share will be a help to other communities. The other thing that we wanted to do was build on the existing relationships and how we could actually partner together. So this project allowed us to think about what was available already in our community. And we knew that we have cancer centers available. We had a project that was already underway by the Genesee Health Plan that was bringing community members together in focus groups to understand what they saw as their needs. So it was just perfect that we could provide additional support through this project for those focus groups. And we learned some great lessons for those focus groups. So we utilized those outcomes from those focus groups to shape what we were doing. I want to share with you a couple of really big takeaways that we found. We have 3 cancer centers in our community. And then we learned through the focus group that there was a lack of awareness about these cancer centers that were already available and the programs and services that were available. We also understood from those who attended the focus group, there was a great change in the landscape. Some people had been on their cancer journey. When I say the individuals or their caregivers had been on a cancer journey for 20 years, and others were just beginning their cancer journey. So some of the resources and services that were available for those who had been around for 20 years were no longer available, and that was due to financial challenges, changes in organizational structure. And in addition to that, there was just much needed support for how you navigate the cancer system on your cancer journey. No matter where the person is on their cancer journey, there's still a need for additional support. And then we identified the need to support the caregiver even a little bit more. So this ongoing need for support in cancer for cancer patients not only dealt with the financial part, but it also dealt with the social status as well. So our first step with the partners was really we had to get together and start talking about it. What do we see as the program? What is it that we want to offer? So when we looked at the focus group understanding, we found out there were some personal needs like buying groceries or paying for utilities that were not available even through the cancer centers. There's some funding there, but there were certain things that even though there were necessary needs to be met, there was not always funding there. So after the next wonderful thing we were able to do was provide some support for those cancer centers to be able to address some of those special and personal needs. And then we had to talk about, so once we got the cancer centers a little bit more resources that they can help the individuals with right now crisis, what do we want this long-term project to look like? So what we learned, again, going back to the conversations with the individuals in the focus groups, is where do we go to get information that's timely, that's relevant? Even though we know things change, how do people know about what's available? So one of the things we discussed was how do we present available service? What's the message that we wanted to send through this project, and what would be the best mechanism? So we decided a web page. So we had to figure out what the web page is going to look like, what the title is going to be, how will it be engaging, right? And so it was very interesting because our partners, we came together, we had a lot of conversations, but we needed some help. So we brought in a marketing firm, Olmsted and Associates, who we appreciate so much. They took all of our ideas and began to synthesize them and try to tell us how to make it crisp. And then we were able to review that and look at the colors. We just really wanted it to be not just a static website, but something that was inviting and engaging and would allow people to feel like this is something for me. And so what we came up with was the title of Hope Hub. Where can we provide hope for our community? And where can it be a hub of information that can be consistent for them to receive that information? So what happened then is, gosh, how do we present this? So we talked to the caregivers, the social workers, and health navigators at the cancer centers and requested that they would be the face, because they're the ones that our community members are going to actually interact with. And so once it's done, we're working on it. It'll be a little bit yet, but once it's done, you'll see the faces of the social workers and navigators actually talking about the programs and inviting those who are on their cancer journey to connect with them. It's not just a static where there's a list of services that are available that might change at any point in time, but actually people want to see a face. How do we really get connected? And so we're hoping in the next couple of weeks, you'll be able to see this website with engaging partners from our community and an ongoing conversation about what's best. Because again, if we can reduce the financial burden by people understanding what programs and resources are available to them, we believe this will be a long-term sustained change positively for the members of our community. So we're looking forward, Mindy, to great things.
We sure are. Yvonne, you gave me goosebumps. Cancer is most certainly an equalizer. Well said. And thank you so much for your time today, your dedication. We are very appreciative of you and your partnership. The next program that we wanted to highlight today also began to take shape in 2019. It was the year of ideas, I think. It is called Water and Fit Colorectal Cancer Screening Initiative. It's maybe not well known that Flint residents still need access to clean drinking water. This is made possible through distribution sites within the city, the largest of which is run by Bishop Jones and his very lovely wife, Mother Jones of Greater Holy Temple Church. They serve thousands of individuals every single week, not just with water, but also other basic essentials like food and clothing. It's not uncommon to see cars lined for blocks for several hours while people are waiting to receive the items that they need for the week or the coming weeks or the coming month. So as it would be, Dr. Todd Lucas of Michigan State University, who we had the pleasure of hearing from during our first Flint Community Conversation, he has a lot of friends, and he's also a friend of Bishop and Mother Jones. And upon hearing of their great work and all of the wonderful things they were doing for the community, he had the incredible idea of partnering with them and the American Cancer Society and the local hospitals to provide a free colorectal cancer screening initiative for the people that are waiting in line for their weekly items. We thought this is perfect. These are people that may not have a primary care physician or may not have a lot of access to screening. And so Todd offered the idea of offering free take-home fit test kits, hence water and spit. For people that are waiting, they can very quickly and easily sign up for a kit. If they want to, they can talk to a patient navigator, and if needed from their test results, they will get connected to follow-up care. It just so happens that we have this beautiful video. It's a short video, but it will give you goosebumps highlighting this wonderful program in our community. We'd like you to take a look.
When the water crisis first started, we were allowing people to come and pick up water 7 days a week. It's the R.L. Jones Community Outreach Center on the campus of Greater Holy Temple. We have a help center. It's the COC's help center. This is where people can drive through that have the transportation to drive through. They can pick up water, food, come inside. In any given week, we affect right at 5,000 residents. Actually, we were exposed to colon cancer through my husband.
It just hit me. I was over 60 then, and I had never had a colonoscopy. And I said to my wife, I think I should at least check this out.
We were watching Oprah together.
The ad talked about testing and screening, which would be so important for early detection.
If you find out early enough, you can do something about it. But it's when you wait. And colon cancer is sneaky.
And when I was told that I had cancer, I immediately let my church know.
I'm touching your house every single week, and I'm thinking, okay, we need to let these people know what we know. So that's why, in my opinion, it fits into our model.
I think it's people like me, people who have experienced that. We have to tell the story. If you're not sure about the colonoscopy, the FIT kit would be a great suggestion. You can do it at home, at your own leisure, at your private time and private home. I think that's great. And you can send it right back through the mail. You don't have to deal with it. Somebody else will take care of it. As a matter of fact, the kit test is available right here at Holy Temple during the month of March. I would encourage you to stop by the church and get one. And then there's no cost to it right here at Holy Temple. You can get it for free. How many things can you get for free that is so important as your life itself? Come by the church and get a kit test. Can save your life.
What an absolutely wonderful group of resources to have here in Flint. The more I learn about the things that are happening here, the more I'm impressed. I want to share with you another cool thing that is happening. When we saw the list of partners in this Hope Hub program, one of the names that you may have noticed was Josh Bedell. Josh Bedell is a nurse navigator, oncology nurse navigator for Ascension Genesis. And he also happens to be somebody who has committed to join our Real Men Wear Pink of Mid-Michigan 2021 class. As we see, great things are happening because of great people. So Real Men Wear Pink is awesome. It is an opportunity for people to dress like me for a month and set a personal fundraising goal to help save more lives. We have been through 5 years of this, and it is phenomenal the things that we've been able to do, the relationships that have been born, the stories that we've heard, the people that have been touched. Here is a look at our top 5 finishers from each year from the Flint market. I am certain that you see names on this list that you recognize. Awesome, awesome individuals who have done so much to help us move our mission forward. Why do we have question marks there for 2021? Well, we do have a number of committed people that are absolutely fantastic, but they're looking for friends. So as you're listening to me and you're thinking, wow, who do I know that would have the courage and the pizzazz to wear pink every single day and look amazing, and has the resources to raise funds, maybe not the levels that you see here on this slide, maybe even more. But somebody, you've got to be thinking of somebody right now that could fit that bill. We invite you to please share that opportunity with them, share their name with us so that we can follow up. The one thing that each of the people on this slide have in common is they had fun. They were doing fulfilling work, having a blast, just leaning into their own hobbies and their own network, but knowing that they were helping us to move the needle. And we invite you to invite others to join with us. We have 8 minutes left on our half-hour time frame. So, I see an email address in the chat. Rebecca, is this somebody that you're nominating for Real Men Wear Pink, Brian Ivory? I am happy to reach out to him. We'll get him. It's going to be great. So we want to thank you for joining us today. Please share any questions that you have, any comments about any of the things that you've seen in either of our first 2 community conversations, because whether we have the opportunity to address any of those comments live, or we take the opportunity to turn those into future community conversations, we certainly love to hear from you. The things that you want to hear about are the answer. They're exactly what it is that we're trying to do with these. So please tell your friends. Again, we plan to continue this indefinitely, about once a quarter. So while we do not yet have a firm date for our next one, watch your emails, because we will be, starting next week, we'll be planning the next one. So we love to hear from the partners that we have, to know about the great work that is happening here. And with that, we will invite you to enjoy the rest of your day. Have a wonderful Tuesday, and we hope to hear from you again very soon. Thank you.
Bye, all.
Mindy, that was a great video for